Hello everyone, myself Sneha Dange from Dr. Hari Singh Gaur University Sagar MP. My topic is inflammatory response. So, first let us know what actually inflammation means. Inflammation is basically a vascular and cellular response to an injury or trauma in order to dispose of the foreign materials which had invaded our body and so as to repair our damaged tissues. These foreign materials can be any pathogen, irritants, bacteria, virus, etc. So, in other words, we can also say that the chemicals from our body's white blood cells they enter our blood or tissues to protect our body from invaders. Now, let us know what actually causes inflammation. Inflammation, there are a variety of factors that can stimulate inflammation includes microorganisms, physical agents, chemicals, inappropriate immunological responses and tissue death. Infectious agents can be viruses, bacteria, etc. Viruses give rise to inflammation by entering and destroying the cells of our body. Physical trauma, burns, radiation injury, frostbites can also damage our tissues. Various corrosive chemicals such as acids, alkalis, and oxidizing agents can also help in inflammation. Inflammation can also result when tissues die from a lack of oxygen or nutrients, a situation that often is caused by the loss of blood flow to the area. Now, there are two types of inflammation. One is acute and other is chronic. Let us first know what actually acute and chronic inflammation means. By the word itself, acute means a short-term process. So, acute inflammation is a short-term process occurring in response to the tissue injury, usually appearing within minutes or the hours of invading of the microorganism, whereas the chronic inflammation refers to a prolonged inflammatory response that involves a progressive change in the types of cells present at the site of inflammation. It is characterized by the simultaneous destruction and repair of the tissues from the inflammatory process. Here, I have summarized in the form of a table. Now let us discuss about acute and chronic inflammation. The causative agent of the acute inflammations are pathogens, any pathogen like virus, bacteria, frostbites, anything, or the injured tissues. So, the chronic inflammation is caused by the persistent acute inflammation due to the non-degradable of the pathogens by the acute response, persistent foreign bodies or autoimmune reactions. The major cells involved in the acute inflammation are neutrophils, mononuclear cells which includes monocytes and macrophages which perform phagocytosis and removes the foreign material. Chronic inflammation cells involved are mononuclear cells, monocytes, macrophages, lymphocytes. Here plasma cells and fibroblasts are also used because the adaptive immunity is set on. The primary mediators in acute inflammation are vasoactive amines. These vasoactive amines are basically the amino acids containing serotonin and histamines, which are released from the mast cells in order to dilate the blood vessels. In other words, it is known as vasodilations. Chronic inflammation primary mediators include cytokines, growth factors, hydrolytic enzymes, etc. So, when the foreign material enter our body, the first thing which get activated is the acute inflammation. That means its response is immediate and the chronic inflammation is delayed, which comes after the acute inflammation. The duration of the acute inflammation is few days and chronic inflammation may last up to months or years. The outcomes of the acute inflammation are abscesses formation or the acute inflammation may convert into the chronic inflammation. Further, chronic inflammation causes tissue destruction. It may even cause severe autoimmune disorders, fibrosis, etc. Here, I have described in the picture form what actually causes acute inflammation and chronic inflammation. The results of acute and chronic inflammation. something like allergic reactions, infections, any injury, burns, it first causes acute inflammation, and then prolonged acute inflammation causes chronic inflammation, which can further get converted into cardiovascular diseases, neurological diseases, rheumatoid arthritis, like autoimmune disorders, cancer, etc. Now, what are the signs of infection? How do we know that our body is infected? So, there are five cardinal signs of infection. These are redness, which is known as rubor, heat, known as calor, swelling, known as tumor, pain, known as dolor, and loss of function. Here, I have summarized the causes in a form of a table. So, let us know it one by one. Redness is caused by the dilation of the small blood vessels in the area of injury. Heat results from the increased blood flow through the area and is experienced only in the peripheral parts of the body such as skin. Fever is also brought about by the chemical mediators of inflammation and contributes to the rise in temperature at the injury. Swelling, also known as edema, is primarily caused by the accumulation of the fluid outside the blood vessels. The pain is associated with the inflammation, which results in the part from the distortion of the tissues caused by the edema, and it also is induced by certain chemical mediators of inflammation such as serotonin and prostaglandins. Loss of function may result from the pain that inhibits the mobility or from the severe swelling that prevents the movement in the area of injury. I'll further discuss it in the mechanism of inflammatory response one by one. Now, let us discuss what cells are involved in the inflammatory response. So, the cells involved are mast cells, tissue macrophage, complement proteins, and neutrophils. Let us discuss them one by one. What is mast cell? A mast cell is generally known as mastocyte, is a migrant cell of a connective tissue that contains granules which are rich in histamines and heparin. It is a type of a granulocyte which is derived from the myeloid stem cell, that is a part of our immune and neuroimmune systems. These cells, they get activated upon the entrance of a foreign material into our body. They play the role in the inflammatory response as detecting the invading foreign material, to secrete the histamines, which further leads to the vasodilation of the blood vessels in order to increase the vascular permeability. This increasing permeability causes neutrophils to move to the infected area. Tissue macrophages. Tissue macrophages in the bloodstream are called as monocytes. These are immature monocytes which get activated to the tissues are known as a macrophage. These macrophages, they get activated by pathogen associated molecular pattern. Their role is to secrete the cytokines. The cytokines are low molecular weight regulatory proteins which are secreted by the white blood cells in response to a stimuli. This also increases membrane permeability and attracts more number of neutrophils and macrophages towards it, that is to the site of infection. One more cells also involved are known as dendritic cells. These dendritic cells, they also act as a tissue macrophage. Now, the complement proteins. The complement, it is a system of plasma proteins. These can be activated directly by the pathogens or indirectly by the pathogen-bound antibody, leading to a cascade of reactions that occur on the surface of pathogens and generate the active components with various effector functions. The complement proteins, they help in the destruction of pathogen by the process called cell lysis. Cell lysis means destruction of the outer membranes of the pathogen by piercing, by making them more attractive to the phagocytosis. Phagocytor. Now, the complement proteins. Complement is basically a system of plasma proteins that can be activated directly by the pathogens or indirectly by pathogen bound antibody, leading to a cascade of reactions that occur on the surface of pathogens and generate active components with various effector functions. The complement proteins aid in the destruction of pathogen by the process called cell lysis and make them more attractive towards phagocytosis. Phagocytic cells are known as macrophages. These proteins it enhances the ability of antibodies which are generated in response to a foreign material and the phagocytic cells to clear microbes and damaged cells from an organism. Thus, this set of complement proteins they promote inflammation so that the damaged tissues can be healed as soon as possible from the pathogen. Now, the other cell involved is neutrophil. Neutrophils, they are the most abundant type of granulocytes and make up to 40 to 70% of all the white blood cells in human. They form an essential part of innate immune system with their functions varying in different animals. Neutrophils are also basically the macrophages, the phagocytic cells which are streaming in the blood. Neutrophils are the first cells to reach to the site of infection. They are activated during the early acute phase of the inflammatory response. As I have said that they are the first cells to reach the site of infection, so they get activated first during the acute phase of inflammatory response. Neutrophils they reach the infected area through blood and then through interstitial tissue by the process called chemotaxis. The chemotaxis is the attraction and movement of macrophages to a chemical signal. Chemotaxis uses cytokines and chemokines to attract macrophages and neutrophils to the site of infection, ensuring that pathogens in the area will be destroyed. The yellowish liquid called pus it accounts most of the neutrophils. Now, let us discuss the mechanism of inflammatory response. As I have said earlier, inflammation is basically vascular and cellular changes. So, let us see here. I have depicted the events in the form of a flow chart. When any injurious agent or any foreign particle enters our body, they damage our cells. These damaged cells they releases kinins, histamines and other chemicals. So, when the tissue is first injured, the blood vessels in the damaged area they constrict, a process called as vasoconstriction. This vasoconstriction is believed to be a part of a little importance to the inflammatory response. The blood vessels they dilate, causing the vasodilation, increasing blood flow into the area. This vasodilation may last from 15 minutes to several hours. Next, the walls of the blood vessels, which normally allow only water and salts to pass through easily, become more permeable. Permeability increases due to the increased blood flow. So, the increased blood flow it causes redness, and redness in turn gets converted into the heat. The heat which is released into the tissue cells it increases the metabolic rate of the tissue cells. Next, these capillaries which normally allow only water and salts to pass through, they become more permeable. So, the protein-rich fluid called exudate is now able to exit into the tissues. Substances in the exudate includes clotting factors which help in preventing of infectious agent throughout the body. Other proteins include antibodies that helps in destroying the invading microorganism. These leaked proteins they enter into the area and form a clot in the infected area or the injury. Next, when the capillaries they become leaky, the fluid contains all the cells in the blood capillaries, they get exudate in the fluid surrounding tissue. The surrounding tissues, it causes edema that is swelling. swelling, and pain. The swelling and pain, if caused severe, can also result in the loss of movement and functioning of the injured part. Next is the cellular changes. The most important feature of inflammation is the accumulation of the white blood cells at the site of injury. Most of these cells, they are phagocytes and certain cell-eating leukocytes that ingest bacteria and other foreign particles also clean up cellular debris caused by the injury. The main phagocytic cells involved in acute inflammation are the neutrophils. These neutrophils, then monocytes and other WBCs, they enter into the injured area. These neutrophils are basically the type of a white blood cells that contains granules of cells destroying enzymes and proteins. When the tissue damage is slight, an adequate supply of these cells can be obtained from those already circulating in the blood. But when the damage is extensive, stores of the neutrophils, some in immature form, are released from the bone marrow where they are generated. So, to perform this task, not only must neutrophils exit through the blood vessel wall, but they must have been actively moved from the blood vessel towards the area of the damaged tissue. This movement is possible by the chemical substances that diffuses from the area of the tissue damage and create a concentration gradient followed by the neutrophils. The substance that create the gradient are called chemotactic factors, and the one-way migration of the cells around the gradient is known as chemotaxis. So, the large number of neutrophils and monocytes, they reach to the site of infection. After the neutrophils, often 24 to 28 hours after the inflammation begins, another group of live white blood cells called monocytes, which eventually mature into the cell-eating macrophages in the tissues. Macrophages usually become more prevalent at the site of injury only after days or weeks, or we can say in the chronic inflammation. The outcome, it depends upon the cells in the tissues involved and the amount of destruction that has occurred, which are in turn related to the cause of injury. These all processes, they result in the healing slowly. During this healing process, the damaged cells, they are capable of proliferation and regeneration. Different types of cells, they vary in their ability to regenerate. Some cells, such as epithelial cells, they regenerate easily, whereas others, such as liver cells, they do not normally proliferate, but can be stimulated to do so after the damage has occurred. For regeneration to be successful, it is also necessary that the structure of tissue should be simple enough to reconstruct. So, what is the significance of inflammatory response in immunology? Inflammation, it plays a vital role of immune system's response to injury or any infection. It is the body's way of signaling the immune system to heal and repair the damaged tissues, as well as defend itself or defend our body against the foreign invaders, microorganisms such as viruses and bacteria. This inflammatory response is emerging in the field of immunology. It is creating an important link between the pathology in humans and the inflammation process, physiological process in studying autoinflammatory syndromes, etc. Recent advances that have been driven by increased understanding of commensal microbiota, immunometabolism, and cancer by the technical advanced methods. This evolving mechanistic and conceptual understanding of inflammation, it drives our insight into the human disease and new approaches for the therapy. Thank you.